people actually asking me as a doctor, and I think there's actually quite a lot of evidence that acupuncture is and has been subjected to controlled trials and is effective in certain conditions. And when you are in practice, let me introduce you to people with chronic care, chronic conditions that we as Western trained doctors are not good at treating. You'll deal with people with chronic fatigue, you will deal with people with chronic headaches, you will deal with people with general body pains, and you won't be able to find what's wrong with them. And you'll put them through 1,000 MRIs and tests and put them on a wait list, and you'll still not be able to find what's wrong with them. And actually, some of those patients do very well with a naturopath or a massage therapy, with changing their lifestyles, with looking at their diets, with doing more. And I think this is a green way of looking at things. Let's look holistically. So more of a spiritual look towards healing. And I can promise you that if you're a physician, there will be times when you will be grateful that you have alternative healthcare to turn to. Because we're really not trained for dealing with a lot of those problems.
So I think there's one more question over here in the middle.
And I love my acupuncture.
So I'm not a doctoral student. I'm actually I'm a doctoral student, but in social work. So I know about this from a different position. I think so far, you haven't spoken much to social determinants of health, which is a big issue for social work. But I'll leave that aside. Social work is an integral part of delivering healthcare, as you know. And so far, I haven't really heard that addressed at all. And we're being pushed out in that system.
We all did, actually.
Hold on. I'm hearing more about training doctors, about that. I'm just speaking to social workers in that field. Is there any part of your target social workers and not just doctors?
I think that if you were listening, I said that I had looked after 2,000 patients, and if I'd had a social worker, if I'd had a nutritionist, I probably could have looked after 4,000 patients.
That was actually really rude because I was listening. I was just asking if you're part of
I'm just,
social workers.
but this is what the team is about, and I think that coming from Women's College Hospital, where it's a social worker that actually runs the sexual assault care team, that has been the whole concept of teams. And I think community health centers and all of the really more modern-looking approaches to health and healthcare are actually in finding that social work is absolutely essential to the care. And so it's really important that in looking at the big picture, that you understand how essential that role is, but that it is part of a team.
So the Liberal are looking to, all I'm asking, and I was listening, is that they're looking to educate more social workers or bring them into the healthcare system?
Well, that actually ends up a provincial decision. Michael Ignatieff, because of LAMP in his riding of Etobicoke Lakeshore, is enamored with community health centers and the role that social workers play there. And so on the bigger picture, we'd say that we incent all models of primary care reform that includes, you know, and the team that is sort of depending on what population you're looking after. But I would say that I can't think of a family doctor in Canada who wouldn't want to be able to avail themselves of a social worker for a lot of what they see every day.
Michael, do you want to comment?
So all of the messaging that I've heard from my party, specifically on this, when we talk about community-based care and healthcare hubs, the social worker is usually the third person mentioned, like over and over and over again. Sometimes nutritionist, sometimes physiotherapist, but always social worker. Usually goes doctors, nurses, social workers is part of our metric. Our rhetoric and our discourse around these issues as being important as part of the formula for success.
Yeah, and in terms of, I think that you're right. I didn't mention social workers. I certainly didn't, but I did mention poverty, and I think we have to be aware that heart disease, diabetes, cancer, psychosocial issues are all increased in those people living in poverty. And we need, again, as I say, as Greens, to get to the root cause of the problem. Why are 15% of Canadian children living in poverty? This is such a wealthy country. Why are we not tackling child poverty? And so...
Thank you. So, unfortunately, we're out of time for questions. I know that many of you have a lot of questions, and I don't know if the three of you would be able to stay and chat with people for a few minutes afterwards. But at this point, we're going to give each of you the opportunity to make a 30-second closing statement so you can re-emphasize the important points that you want us to remember before we say goodbye for the evening. So we'll start with Michael, and then we'll go to Dr. Bennett, and then we'll go to Dr. McCall.
So thanks everyone for coming out tonight. 30 seconds isn't a lot of time, but there's a lot of pieces that I actually didn't get to as a part of our healthcare plan. For example, there's a whole piece around pharmaceuticals and the implications that pharmaceuticals have for healthcare, which is in our platform. It's all available online, ndp.ca/platform. And it's actually the third piece. And our healthcare isn't sort of salt and peppered in different parts of our platform. We actually have a healthcare platform. So if you could look at that piece, that would be great. And again, I think that it is unfortunate that we didn't have our Conservative representative here. I think we all know that's quite telling, right?
Thanks so much.
And okay.
Sorry to cut you short. All right, Dr. Bennett, and then Dr. Wolf.
I just want to say that it's been, thank you all for being here and for caring. This is that every single one of you will end up being able to fight for the things that we know matter in keeping as many Canadians healthy as possible. And that does mean dealing with the social determinants of health, of poverty and violence, and the environment, affordable housing, education, equity. And on the risks, as well as making sure that there's quality care. This election is about who you trust to actually put that whole of government approach, and we hope on May 2nd you'll vote. We'd love you to vote for us, but we just want you to make sure you get as many people out to vote as possible.
All right, Dr. Wilcock.
We've talked about MRI machines, we've talked about wait times, we've talked about social work, but I got into politics, and I'm standing here, as I said before, because I am concerned about the climate crisis. And we, as physicians, need to start thinking about how we're going to manage it. How are we going to deal with the ill health and deaths that will accompany climate change? Heat waves have a profound effect on human health. In the European heat wave of 2003, 10,000 people died in Paris alone. Worsening storms caused death, injury, and displacement. Displacement of people from their homes by floods and storms create an enormous toll on our social and physical well-being. When are we going to stand up and deal with the issues? And I'm saying, please vote. Under 30s, only 25% of you vote. Please, everyone in this room, vote. And you don't need a voter's card. You just need 2 pieces of ID and proof of your residence.
All right. Thank you very much. I think all of our candidates deserve a big round of applause. So again, I'd like to thank all of you for coming out and sharing your vision with us, and we certainly wish all of you the best in the upcoming election. We do have some thank yous for you, so I'd like to invite Alex Petrie, Jay-Z Yang, and Danielle Roden up to say
drug company funded?
No, they're not.
They're student funded.
Thank you.
And so I'd also like to ask Jesse Cansier, where is he? Did he run away? To stand. Oh, there he is. To stand up so we can all give our organizers a lovely round of applause as well. And Jesse. And so finally, I want to thank all of you as our audience for coming out and participating tonight. As our candidates also reiterated, May 2nd is coming up fast, so be sure to get out and make your vote count. Have a great evening, guys. Thanks so much.
And thank you to Kate for being
here.